Dr. Zekeridou, a research and clinical fellow at Mayo Clinic in Rochester for the last 4 years, and now we're delighted to have her on staff in the section of autoimmune neurology. She is particularly interested in paraneoplastic disease and the study of onconeural antigens, particularly in the setting of patients on checkpoint inhibitors.
Thank you for inviting me. I'm very happy to be here to talk about paraneoplastic autoimmunity, and the clinical considerations in the area of checkpoint inhibitors. I don't have any relevant financial disclosures. I will be talking a little bit for the use of immunotherapy in paraneoplastic neurological diseases. So what is actually paraneoplastic neurological autoimmunity? So it's evidence of a spontaneous anti-tumor immune response. So we have proteins that are normally restricted in the nervous system that now are expressed by the tumor as onconeural antigens. For example, acetylcholine receptor, MAP1B, amphiphysin, aquaporin 4 water channel. So before the era of checkpoint inhibitors, the most common tumors that we will see with paraneoplastic autoimmunity would be small cell, thymoma, gynecological tumors, including breast and seminoma. So how does paraneoplastic autoimmunity work? This is a very simplified version of it, but I always use it because it helps us understand. So we have the tumor that is expressing in green the onconeural antigens. These antigens can be either intracellular or in the membrane. Every tumor will undergo apoptosis, so you will have release of antigen that then will be picked up by the antigen-presenting cell that will travel from the tumor bed to the lymph node and will present it via the MHC molecules to naive T cells that will turn them into cytotoxic T cells that are specific for the onconeural antigen, but also cross-present them to T helper cells that in their turn will activate B cells to turn them into plasma cells and produce antibodies. So the effectors of the autoimmune response are cytotoxic T cells and antibodies that are actually specific for the onconeural antigens. So these effectors via the blood will travel to the nervous system and will also travel to the tumor. So we have two different types of autoimmunity there. So we have the antibodies that can actually target their protein. So if you have a protein that it's in the cell membrane, then the antibody can go and reach that protein. And so the antibody has pathogenic potential. So it can act with many different ways, actually. It can bind, and then you can have cross-linking and endocytosis, so the antigen gets degraded. You can have loss of function. For example,